Alex, Erecto, nice to see you again in Pune for this DERMACON conference. We are really grateful to you for teaching us dermatology, dermatology and hair transplant surgery. Just wanted to ask you how this thing has evolved in your practice. When did you start and how did you come up? And that is what we would like to know from you.
I'm 40 years, I'm a dermatologist, but 30 years ago I started to do hair transplant. And of course, it was in my beginning, and the 30 years I have experience. But I remember 25 or 26 years ago, I went to Pune to visit my brothers, Dr. Naren and Dr. Sharad Mutalik, and we did a first hair transplant, I think the first hair transplant in Pune,
Yes.
and one of the first hair transplant in India, and we are the pioneers in the hair transplant in India.
Yeah.
Nobody knows what is hair transplant.
That's right.
And people say, what? Hair transplant? Is possible to take hair and put in another place? Now it's so common, so
Yes.
popular. Every city are doing hair transplant. But 26 years ago, we started to do this,
Yes.
and we continue to do this.
Yes, really, but I would like to ask Alex, I am becoming very nostalgic and maybe emotional also. In the year 1998, actually Naren had given me your card and I visited you. First you taught me the facial surgery and took out my fear of the blood, and we did many basal cell carcinomas, melanomas, and then you called me to assist you for hair transplant. It was quite tiring at that time, but it was a boon for my knowledge itself. I'd like to ask you, what made you think of hair transplant? That
How did you
decide that I should go for hair transplant and this branch will boom like anything?
What made you select this?
When I did my resident in dermatology, I did 6 months plastic surgery. And we went to the department of plastic surgery, we went to the Congress of Dermatology Surgery in Jerusalem. And I saw a little television, white and, black and white. There was sit on the chair, a little one, and a doctor from France showed that he's doing hair transplant. I say, what? It was in 1984, 1985.
Oh.
I said, what? It's possible to take hair and implant? And I said, this is what I want to do. And I contact with the doctor. There was Dr. Pierre Boana from France, from Paris. I contact with him. He invited me to Paris, and I went 2 weeks with him, and I started to do hair transplant.
Great.
Okay. How did you start? You start with big punch and then came
Yeah.
to the small punch and strip surgery.
Dr. Pierre Boana, he's a wonderful hair transplant surgeon, and he showed me a new technique with small punches. But everybody did with big punches. And I started to do small punches. But there was a revolution because nobody did small punches. Everybody do 4 millimeter punch. And we start 2.5 millimeter
Oh,
punch.
that's right.
2.5. And now we are doing 0.6, 0.7. But in the 30 years ago, it was 2.5. And for the frontal hair, we put 1 millimeter punches.
Great.
And this is how I start. But interesting that now so many people are doing hair transplant. Everybody want to do hair. The hair is so important in the people. And 30 years ago, nobody think about hair.
Actually, it was a great thing. First, you showed me the complications of 4 mm. And at that time, you showed me that 2.5 is better than 4 mm. But at that time, we were astonished to see your clinic, your private clinic in Ranana as well as in Class Clinic. The name itself proved its class
Teleshomer.
at Tel Ashomer. And we were mesmerized, and looking at your endurance, doing 2 or 3 hair transplants in a day, would like to ask you, how do you keep yourself fit?
You do 2 transplants in a day, plus do
You
your
don't get
surgery.
tired.
Don't get tired. What keeps you going?
I have energy, and today I'm doing 1 or 2 hair transplants a day, and I teach also many doctors from all over the world. I have 100 fellows.
Great.
Yeah, in my record, and from India I have 40 doctors.
Yeah.
Great.
That's
But
great.
Dr. Mutalik was the first, and Dr. Narendra was the second. And this is the reason I say they are my brothers.
Thank you,
because
thank you.
we are 28 years, we are very good friends, and with the families, and we enjoy in every congress we met.
And you have been to Pune to teach our team right from 2002, 2006, 2010, and you come with your team.
Yeah.
How do you develop your team, your nurses? How do you teach them? Because it's not a single-man job.
Not
it is
simple.
a teamwork.
Yeah.
So how do you develop your team?
It's complicated. For the beginning, it's very complicated. It's too complicated to create a team, and the team need to be with you, and to teach them, because 30 years ago was different. Nobody knows about the hair transplant. But my nurses love the hair transplant, and we have a wonderful relationship. And we came from 2 or 3 nurses each time, and 3 times we did hair transplant in Pune, and this I think is my 4th time in Pune.
Yeah, that's right.
Did you encounter any complications, any severe complications during hair transplant? Because looking at the extensive surgery on the scalp, which is a vascular area.
The most important thing is, I think, you need to select the patient. And this is a reason that, for example, I teach only dermatologists and plastic surgeons. Because the dermatologists, they know about scalp, they know about baldness, they know about disease. And this is very important that the specialists are doing hair transplant and not every doctor. Because sometimes a psychiater call me that, or the GP call me that he want to do hair transplant. But if you learn psychiatry, why you want to do hair transplant? Money. But the hair transplant is the dermatological specialization. And a dermatologist can select the patient. And when you select the patients, you avoid complications. Yes. It's very important. And also, you need to have a good teaching, because if you have a good teaching, you know exactly what you do. Especially in India, 2 patients died due to the anesthesia. Because people want to do 5,000, 6,000, 10,000 grafts, and maybe the surgery was 12 hours, 14 hours, and you see, they put so much anesthesia, and they have complications.
Alex, how many grafts maximum you advise in a person who is expert in doing hair transplant?
Yeah, I am not doing more than 3,000 grafts a day, but not for everybody. But if I need to do 4,000 grafts, I am doing 2,000 grafts one day and 2,000 grafts the other day.
Yes.
But I not do 4,000 or 5,000 grafts one day, because it's too much for the doctors and the nurses, and also for the patients. And you create a risk.
Yes.
And in hair transplant, that is a cosmetic treatment, you need to avoid the risk. 0 risk.
Yeah. What are you using after the transplant? A-cell, PRP, mesotherapy.
Growth factors.
Growth factors, what are you using in that?
When you are doing hair transplant, the hair is growing. You don't do nothing in the hair transplant because it's growing. You don't need to create more hair.
Right.
Because if somebody have a bald area and you implant with or without another treatments, the hair will grow. You can treat the other place that you didn't transplant.
Okay.
what is your opinion about the eyelash transplant? Is it successful?
The eyelash transplant is complicated. I am doing, but I am doing only to repair, not for beauty. For beauty is not good, but for repair, if somebody did a laser or a operation and he loses the eyelash, it's very important to implant the eyelash.
What is the youngest age you have done transplant?
22, 23. I prefer to do a little bit more older, 24,
Well,
25.
nowadays everybody comes and demands for hair transplant and we refuse below 24 or 25. Is that right?
Yeah, because now, unfortunately, the hair transplant is a business. And now what happened, that the doctor is not doing the hair transplant, they delegate to technicians, and the technicians are doing the hair transplant, and we see very complications, no doctors, no dermatologists, and also no doctors. And they spray that you see in Turkey. In Turkey, for example, there are in Istanbul, there are 450 clinics are doing hair transplant. In Israel, only one clinic.
Yeah.
In all Europe, there are not 400 clinics. In Istanbul, 450 clinics. Why? Because the Minister for Health allow everybody to do hair transplant. Also a barber, also a butcher, everybody can do hair transplant.
Can we expect stem cells in the near future?
We hope, but not yet. Not yet.
What about hair multiplication, hair duplication?
Yeah, the same. They are working, there are different centers in the world are working about this. They create hair, but the hair is growing in different directions, and this is the problem.
Alex, for us, you are a robo. Are you planning to buy one more robo in your clinic?
No, because robot, in my opinion, is for the doctor. He don't know to do FUE, or he don't want to do FUE. The robot only do the holes for the extraction. It's too expensive.
Yeah.
It's approximately $600,000, and you need to pay $1 for each hole are doing the robot.
Correct.
And if you have a good hands, you have $600,000 in your hands.
Yeah.
And for the company is very good, but for the doctors, it's not a help.
What is the tips you would like to give
To the
those who would like to become a hair transplant surgeon? What are the tips to the
The
doctors?
tips is, first of all, be dermatologist or plastic surgeon. Also, go to a place and learn a very good hair transplant, because you need to know all the techniques. You cannot learn one technique because you are not a technician. You need to learn all the art of the hair transplant, and then you decide which technique is better for the patient, and not you take the patient and you give only your technique, because it's not only one technique. It's the same that if you have a laser and you have a CO2 laser and you want to treat everything with CO2 laser. Impossible. You need to have many lasers, and depends the condition, you decide which laser to use. In hair transplant, it's the same. You have different methods, and you decide which method is much better for the patient. Sometimes you say, no, you don't need surgery, you need medical treatment. And this is the reason the dermatology need to do need to treat hair.
Yeah, okay. Alex, what do you feel about coming to India? Whenever you come to India, what do you feel? I mean, what is your...
I love India. First of all, I have my friends, I have my brothers. I love this country, and the hospitality is unbelievable. And when they invite me, I try to come.
Yes, and we are really thankful to you for coming all the way. There was one more conference going on, MCAS, but we are really thankful to you for gracing the occasion, and enjoy the Pune hospitality and enjoy the atmosphere here.
Thank you, Naren. Thank you.